everyone to the webinar today. It's contrasting entry points for intervention in health promotion practice. I see someone's, I thought someone had just written they were in their car, and so I was going to say, put the cell phone on speaker, but you're in your office. So know that this webinar is being recorded, and please mute your own phones except for our speakers. Please stay unmuted, and that way you can contribute as we go. We have two people in the background today from the National Collaborating Center for Public Health. The voice you're hearing right now is myself. I'm Dianne Oickle, one of the Knowledge Translation Specialists, and I'm sitting in Antigonish, Nova Scotia. And our research assistant is Danielle McDonald, who's across the hall from me, but who's otherwise occupied. She was really critical in helping us get this set up and sending the slides out and the registrations out to everyone. So she certainly helped put this whole thing together today. If you have any questions or you want to share resources, have a conversation, please do so in the chat box. The way we will have question and answer period at the end of the webinar, and the way that we'll do it is we'll ask people to post their questions in the chat box throughout. So as they come to you at any time, post your question there. I will keep record of that, and then we'll keep participant lines muted at the end, and I will verbalize the questions to our speakers to respond to. So please do add any comments and questions in the box there as they come to you. As many of you probably know, we are one of 6 National Collaborating Centers for Public Health. I won't take a lot of time to go through detail on that. We are the NCC for Determinants of Health, and we're located in Antigonish, Nova Scotia. We'll pop up our website for more information towards the end of the webinar, but if you wanted to learn more about the collaborating centers in general, you could go to nccph.ca to learn more about all 6 of us. Most importantly, I want to start off by acknowledging the land where I physically am sitting right now. The NCCDH is hosted by St. Francis Xavier University. That is in Antigonish, Nova Scotia, and that is in Mi'kmaq, which is the ancestral and unceded territory of the Mi'kmaq people. This territory is covered by the Treaties of Peace and Friendship, which Mi'kmaq and Wolastoqiyik peoples first signed with the British Crown in 1725. These treaties did not deal with surrender of lands and resources, but in fact recognized the lands and title and established rules for what was to be an ongoing relationship between nations. And I'm very proud to say that the university has recently raised the Mi'kmaq flag permanently. It permanently flies next to the university flag and provincial flags here on campus. So we're very, very thankful to be on.
To Health Promotion Canada, and then I'm going to pass it over to Irv to do a little bit of background around the Health Promotion in Canada book and where the idea for these webinars came from. So I need to advance a slide. So so I'm going to speak initially, talk a little bit about Health Promotion Canada, then Irv's going to come on and he's going to talk a little bit about the idea behind these webinars. For most people probably are aware that we have been working for the past couple of years to try to establish a national voice for health promotion in Canada. I'm just looking at all the participants in the list, and I'm seeing lots and lots of my friends and colleagues from public health across Canada. So really lovely to see lots of familiar faces over there. So I know that people know that this Health Promotion in Canada, we've been trying to establish as a national organization, slowly but surely, as a voice for health promotion in Canada, because we really want to advance the practice of health promotion. We're trying to connect students, researchers, and practitioners, as well as employers from across Canada, in order to ensure that the work of health promotion broadly is advanced. And when I note that we're also wanting to have employers involved, one of the issues there is that Health Promotion Canada, we've not imagined that it's strictly for example, public health health promoters, but actually we recognize that there's health promoters operating in many different sectors. So there's a lot in the NGO sector, people who are working on, let's say, in the disease NGOs, for example, heart and stroke and cancer. There's a lot of health promotion work that happens there. But we also know that we have friends and colleagues working in the different social advocacy organizations, working on housing, working on food security, and those kinds of initiatives. We have social workers working in social service organizations that are doing health promotion. We have people working in municipalities around community development. So our vision for health promotion in Canada is actually very large. But of course, the challenge is getting the volunteers to basically build the organization. So this is an open call to anyone who's interested in getting involved, to really encourage you to buy a membership, and there are student memberships, so that we have the money that we need to be able to offer some of the services, supports that I'm going to talk about in a second, but also to get involved as a volunteer. So Irv and I have taken on some of the volunteer role of building connection and professional development with the health promotion community in Canada, which is why we've been involved in getting these webinars going. And we're also very active in our BC network and getting that BC network developed, because we're both located here in British Columbia. But this is happening all across Canada, and we can put you in touch with the right people. So that's my first kind of promo message around Health Promotion Canada. And the other thing that I wanted to say is that on the website, you'll find a number of resources that you'll find very useful. One of them is the collection of health promoter competencies. So anyone who's been involved in public health over the past 10 to 15 years, you know that Public Health Agency, our friends over there, provided some funding in order to develop the very first set of public health competencies, and then supported the different disciplines, whether it's nutrition or public health inspection or medical health officers, to develop competencies as well, so that we had a really strong set of competencies across Canada focused on health promotion, or focused on public health specifically. And then the last of these to be developed, and they were just completed, I guess, 2 years ago or 3 years ago now, are the health promoter competencies. So I would encourage you to go over to Health Promotion Canada website and download those competencies. And you'll also see over there that there's a place for you to sign up for the Health Promotion Canada newsletter, as well as find the links in order to send an email to your regional network people, such as Irv and I, if you're in BC, and get connected at the level of your region. And finally, if you do sign up and pay the membership fee and become a member, you will actually have access to the complete competency toolkit. So that toolkit includes all kinds of materials and resources for example, if you're a manager and you want to redevelop a job description, or you want to develop an evaluation form for your organization that does a really good job of evaluating the health promotion actions of your staff. There's all kinds of different checklists and tools and resources that you'll be able to use as a manager for that particular kind of development of your workforce. So I'd really encourage you to join and go over and get access to those. And I also, you can access the member list. So we make the member list available to everyone who joins, and then you'll be able to reach out more easily to your colleagues across Canada. So I'm seeing in the chat box there's a question from Angela. Thanks, Angela, around whether this organization is connected to Canadian Public Health Association. So the Canadian Public Health Association is, I guess, a friend and champion, and some of the local regional areas, for example, in BC, we have a very close relationship with the Public Health Association of BC, where they've put some information on their website to help people connect with us. So we don't have a formal relationship with the Canadian Public Health Association. And part of the reason for that is we see our audience and mandate as broader. So Canadian Public Health Association really is focused on public health practitioners. We see our work as really linking people even more broadly than public health strictly. So they're certainly part of our network. Okay, let's see. Let me move on. So, and then in this competency, in the competencies in the toolkit, you'll see, the format and this is a little bit wonky. Hopefully you can still read it. But we have 9 domains and then 34 statements. So it looks a lot like other competencies in other disciplines, but they are the kinds of statements that would apply across disciplines. So I'd really encourage you to think about trying to use these within your own discipline. And also they were built with the idea that you use multiple domains and competencies in any activity that you do as a health promoter. So it's kind of an integrated competency tool set. And then the last slide that I want to speak to is just to remind people that these competencies are a valuable approach, I guess, for the foundation of working with your staff, with your colleagues, and also working in the community. So if you are working, for example, in public health and you are engaging with people who are doing health promotion in municipalities, but they maybe have a little bit, they don't call themselves health promoters, you may find it useful to use these competencies to be able to illustrate how what they're doing in, as you know, a municipal, I guess, healthy community lead or healthy built environment kind of activities, how they are in fact a competency. So you can use these competencies to do a number of different things in engaging people around your health promotion priorities. So that's my pitch for Health Promotion Canada. I'm really happy to be here. I'm really thankful that the National Collaborating Centre, who I used to work with, is partnering with us on this webinar, and I am going to pass this over to Irv, who is going to talk about health promotion in Canada and where the idea of these webinars came from.
Great. Thanks, Leslie, for that introduction and for your words. Yes, I'm going to talk a bit about where the idea of the webinar series came from, and in particular, the idea came from the Health Promotion Canada Professional Development Working Group that I co-chair with Jane Springett. I also was the lead editor on Health Promotion in Canada, and so was able to offer that as a resource for a webinar. And we approached the National Collaborating Centre on Determinants of Health, suggesting doing a series based on the recently released 4th edition of Health Promotion in Canada that has 15 new chapters and a new afterword written by Ron Labonte, as well as an instructor's manual. So the 4th edition is significantly different from the 3rd edition, although there are some chapters that were updated from the 3rd edition, and the one that we're going to be talking about today was one of those chapters that was updated. And we were delighted that the National Collaborating Centre agreed to sponsor a series of 5 webinars based on 4 of the chapters in the book, which are listed on the next slide. So in addition to the chapter that we're discussing today, we'll be doing webinars on Indigenous health promotion, participatory practice in health promotion, and health in all policies. And the 5th webinar is one that's based on the chapter that we're talking today that will be conducted in French and held on July the 10th, as Leslie has mentioned. Each of the webinars will feature an author of the chapter as well as a health promotion practitioner who can comment on their experience of how the chapter translates into practice for them at least. I just want to say a few words about the future of health promotion, which was one of the topics that we discussed in the concluding chapter of the book. I could say a lot more about the book, but I don't want to use up time today. So, as I'm sure that you have signed up to hear what is said about today's topic, so I'll just say a few words about what the book had to say regarding the future of health promotion. We started it with a caveat that came from Alan Turing. We can only see a short distance ahead, but we can see plenty there that needs to be done. That quote was found by Ann Peterson, who is one of the co-editors of the book. Basically, what we did in the last chapter was to consider some of the forces that will impede further development of health promotion and other forces that will enhance development. So on the impede side, the key ones that we noted were elimination and downsizing of university-based health promotion research centers, elimination and downgrading of health promotion practitioner positions, and priority given to health care as opposed to promotion. So that's the downside. The upside is that that will enhance our future development is that the core principles are principles that do animate health promotion as well as many other fields, including public health. Secondly, increased integration and collaboration with public health and population health as well as other factors and sectors. And I think we're seeing a lot more of this today, and I think that's a plank to build on. The next one was development of health promotion capacities and standards, which were just mentioned by Leslie. A strengthening of the health promotion settings movement, new transformative leaders. We've been very lucky to be encountering new young people who are interested in health promotion and interested in taking on leadership roles, many of them who are already involved with Health Promotion Canada. And international engagement is another strength that we have in Canada. Canada is still considered to be one of the leading countries in health promotion around the world. And then finally, we've been just established, as you heard from Leslie, new national and provincial organizations and networks in health promotion. So we hope that this series will motivate those of you who have not yet been involved to support the development of Health Promotion Canada nationally and provincially. And as Ron Labonte suggested in his afterword, think globally and locally and act globally and locally. Finally, I'd like to thank our sponsors, namely the National Collaborating Centre on Determinants of Health, as well as Canadian Scholars Press, which was able to provide us with complimentary copies of the entire book for the professional, the commentators on in all of the webinars. So now I'd like to just turn the webinar over to Martine, one of the three authors of the chapter that's the basis for this webinar, although I think Diane's actually going to say a few words to introduce her. Thank you.
Yeah, thanks, Irv. That's perfect, and we really appreciate working with Health Promotion Canada on this series. You guys have been great partners and great thinkers on this, and so we really, really appreciate that. So I am going to introduce our first speaker, and that